Hello, I'm Kai from Medical. I will introduce you an ICU bed D6 from this video. No doubt, it's a fascinating ICU bed either from the streamlined design or the details. The bed is constructed with two-column structure, which is a good point for the hospital staff to do infection control and bed hinging. As for the functionality, the bed has excellent parameters. All the control buttons are located outside of the side area, facing outside on the both sides, and with visible icons. Due to the construction by two columns, the bed has a big height adjustment from 500 to 900. So when it's to the lowest position, it's easy for patient to get exit of the bed, and for the highest position, it's easy for doctor to communicate with the patient. And with the big gap underneath the bed, so it provides the accessibility for the C-arm exam. For the basic operation for the backrest, if you can note, when we adjust the backrest, and the knee rest is also can be raised to stop the patient from sliding to the end. And besides the basic operation like backrest, knee rest, height adjustable, Trendelenburg and a reverse Trendelenburg, and one bottom flat position can convert the bed from a complicated position to a flat position. And one bottom CPR position, electric. Also, we have a manual CPR function located on both sides of the bed. Let me operate it. From here, if you pull the buckle, the backrest can be raised down immediately. The side area is designed with safety mechanism. The operation for the side area is by this buckle. And the safety mechanism is that if the patient is trying to operate the buckle from inside, then they will push the side area. Now you cannot operate it. So when the medical staff is to operate the side area, they will push a little bit inside and operate this buckle easily. And for the side area, we have the angle indicator located here and here. This is for the backrest. And this side area, the angle indicator is for the Trendelenburg and reverse Trendelenburg. And for the bed head and end, both it can be detachable for emergency rescue. And we have bumpers located on the four corners of the bed. So in case we are transport the bed, and it can avoid the collision with the wall or any medical equipment. The bed is equipped with central brake, and the central brake pedal is operated from both ends, here and the other is here. When you unlock the bed, the unlock safe alarm will be triggered. Now you can hear the sound of beep beep beep. And also we provided the steering function for the bed. If you lift the pedal to the top, and you can see this wheel cannot rotate, so the medical staff can transport the bed to the designed direction. Safety management are also the key features for this YA-D6. We have bed underneath the bed as the night light, so when the night light is on and the ICU room ceiling light is off, so still it can guide the medical staff to avoid the collision. It's a protection for the medical staff. And also we have a small light is embedded onto the side rail. When the bed is not on the lowest position, it will be on as a red icon. So the medical staff can easily identify the bed is not on the lowest position. So they will operate it to the lowest position. Now the light is off, so the bed is safe for the patient. Patient weighing system is a standard configuration for this ICU YA-D6. And all the operation is operated through this control panel. And this panel is very well humanized designed. It can be rotated, so the medical staff can operate it very easily. And we can either weigh the patient in kg or in pounds, and it can be switched between these two. Now let's weigh a patient. And the accuracy can be 0.1 kg. And we can do the zero release.